Over the last couple of years, I've done some writing about mental health care, and I've really seen some of the stigma start to come away. And I know there's been more public discussion about just the problem of mental illness. Just to quickly put the problem in perspective, 1 in 5 adults in the U.S. experience a mental illness, and 1 in 25 adults live with a serious mental illness. And yet, just 41% of adults with mental illness received professional help in the past year. And of course, last week we had a CDC report talking about the rise in suicides, which is up 30% in the last 2 decades. And then, of course, some celebrity suicides last week as well. Can you share a little bit about your reaction when you hear stats like that, when you hear news like that?
Well, I think first of all, thank you for having us, and thank you for focusing on this issue. You know, I used to run a social service agency that focused on adults with severe and persistent mental illness, and we talked a lot about stigma. We are making progress on destigmatization, and we're making progress on understanding that mental health is health, and trying to integrate the way we think about that. But the problem is we have this sort of labyrinthine system that has to catch up with some of our more advanced thinking around mental health. So it's one thing to say we need to destigmatize. It's another thing to say mental health and physical health are interconnected. But now we have a system which means reimbursements, billing, processing, auditing, statutes, rules, laws, training, availability of care. All of those are kind of systems issues that have to flow from the sort of premise that mental health is health. But then you have to get into the details about how systems work, and that's sort of the hard work of making mental health available for everybody.
Mm-hmm. Senator Tillis.
Well, I do think when I was thinking about this conference, I thought about a personal experience I had about 10 years ago when I was diagnosed with an incurable, potentially fatal disease. And I was put on high-dose steroids for several months, and I experienced pharmacologically induced mania. And then after I came off of the steroids, I experienced clinical depression for nearly 2 months. And I realized that even I struggled. You know, I was a partner at IBM, I was a state legislator, and even I struggled with the idea of recognizing that there was something going on. It was most likely associated with the drugs that I needed to take to prevent me from getting more ill. And so it really hits home at a personal level that we have to, I really do believe that we have to make sure that people understand that today's society views this as if it's an illness on par with a physical illness. It is a physiological challenge that I happen to have that went away after I lost the drugs. And I, for one, think it was one of the great blessings in my life to really see it from the perspective of somebody who wants to see a doctor but doesn't want to admit they need help, then wants to go through the whole process of finding a qualified professional to help me. And I think those are things that we have to continue. Those who have done it need to be prepared to talk about it. I have some staff say, why on earth would you talk about your personal experience? I said, that's a part of the problem, people not doing that. And recognizing there's a path to getting well for many, not all, but for many.
Right.